Hemolysis is part of the pre-analytical errors. This is a topic that you will be tested on when it comes to any phlebotomy exam. Like I said, whether it's the NHA, the AMT, or the ASPC, whatever exam it is, you will be tested on hemolysis. Hemolysis falls under the topic of either pre-analytical errors or routine blood collection. Now, these lists right here, this is what we need to focus on. This is how you're going to pass the exam based on these simple tips. So, hemolysis is our main topic. Remember, it falls under the category of either blood processing or it's pre-analytical error. First thing that we have to know about hemolysis is, what is it? What does it mean? That means it's the destruction of red blood cells, okay? Now, questions that they may ask you is based on these topics right here. Excessively shaking or rotating the blood, right? We want to gently invert the blood in additives. So we're going like this, or we're doing it in a infinity sign, whatever. But we are not shaking it up to break down the red blood cells. That is not what we want. This picture here shows us what hemolyzed blood looks like. The normal color for serum or plasma is like a clear, yellowish, pale color, right? That's the normal color. But this color here, which is the tinged red, our sample is hemolyzed. So excessively shaking is the number one thing. If there is no answers but excessively shaking the blood, that is the answer for hemolysis. This is what causes it. I want you guys to remember, when you're taking the exam, it's how do I solve the problem? And if I can't solve the problem, how do I protect my patient? Okay? And how do I protect myself? Remember the three things that I just said. How do you protect yourself? How do you protect the patient in the integrity of the specimen? Or what can I do to fix the problem? So with hemolysis, we know what the topic is. We know what causes hemolysis. And here's another thing. Failing to allow the blood to run down the side of the tube when a syringe to fill the tube, right? So we're not just going to push the plunger down so that the blood could enter the tube. This is if we've collected using a syringe method, and now we have to transfer the blood from the syringe into the tube. You do not just push the plunger. That can cause hemolysis. Number 3, please remember it. Using too small needle with a respected size of the vein. Okay, so if I have a beautiful, healthy vein and I decide to use a 23 gauge, yeah, your specimen might be hemolyzed. This is one that they like to use. So if I'm being honest with you, number 1 is excessively shaking. They like to use that one. And number 3, using too small of a needle when you're supposed to use a 21 gauge and you're using a 23, that can hemolyze your sample. Using a small needle with a large vacuum. So if I'm using a 23 gauge with a big tiger top and it goes slow, yeah, our specimen may be hemolyzed. So when we look at hemolization or hemolyzed blood, I want you to think of these tips. Remember them, okay? This is how you will pass your exam when it comes to pre-analytical errors. Remember, pre-analytical errors are, what did I do with the patient or before I sent out the specimen? What happened? It's based on the phlebotomist and the patient at this time, all right?